Hello, I'm Dr. George Ampat. I'm a consultant orthopedic surgeon and I work in Liverpool in the United Kingdom. Now we're going to talk a little bit about back pain and how we can do things to prevent back pain and also to cure back pain. But before we proceed, I just want to give a little bit of the anatomy of the back, and I'll also tell you about the muscles that surround the back so that we have a better idea. So the vertebral column are the blocks of bones that come from the head down into the pelvis. So the vertebral column consists of blocks of bones, and in between the blocks of bones are cushions. So there is a block of bone, a cushion, a block of bone, a cushion. Behind each block of bone is a ring of bone, and all the rings put together form a tunnel, and it's through this tunnel that the spinal cord goes. The spinal cord is a continuation of the brain. So from the brain, the continuation is the spinal cord, and there are nerves to different parts of the body. The spinal cord ends just below the chest cavity, and below which you do not have a spinal cord, but there are multiple nerves that are coming out. They still come out through the pelvis, the sacrum, and go to different parts of the body and to our waterworks and bowels. Now the cushions, that is where sometimes the problem occurs. There may be what is known as degeneration. The cushions are pumped up with water. It's like our car tires. Our car tires are pumped up with air, but these cushions in the back or in the spine are pumped up with water. But as we age, they may lose that water content. Sometimes premature degeneration may occur and they lose their water content. When doing an MRI scan, the disc may look black in color because they have lost the water content. And people call it the degenerate disc. It is not just because you're old. It can happen in premature degeneration can also occur. But the usual cause of back pain is not because of degeneration, but because the muscles that surround the spine are not strong. If we were to strip the muscles of somebody, he would not be able to stand up. We are only able to stand up because the muscles are there and the muscles help us to stand up. And unfortunately, muscles can waste away or become weak very quickly. Even a large rugby player, if he is resting, his muscles will waste away very quickly. So it is quite common for muscles to waste away. And unfortunately, when there is pain from any cause, we tend not to move that body part and we splint that body part. So there is an injury or there is pain in the back, our immediate reaction is not to move the back. When we don't move the back, the muscles become weak. When the muscle becomes weak, it doesn't support the spine. When it doesn't support the spine, it increases the pain in the back. It is a vicious cycle. So how do we correct this? We can only correct it by converting that vicious cycle into a victorious cycle. Even though there is pain, we need to do some exercises, the right exercises, and I'll come back to that. And when we do the exercises, the muscles become stronger. When the muscles become stronger, it supports the spine and the skeleton better. When it supports the skeleton better, there is less pain. So you're converting the vicious cycle into a victorious cycle. But it's not just the question of strength of the muscles. Sometimes they lack the synchrony or the sequence. Let me explain that with a metaphor. In a car, where there is a gear system, we have to start with the first gear, move to the second, third, and fourth. We cannot directly slip onto the fourth gear. It has to go in sequence 1, 2, 3, and 4. A similar gear system exists in the lower back. So the muscles around the vertebral column are arranged in layers. The muscle that is closest to the spine or the vertebral column is the first gear and is called the multifidus muscle. The other muscles, the iliocostalis, the longissimus, and the quadratus lumborum are the second, third, and fourth gears. We will call them erector spinae in clubbing together. The center muscle or the muscle that is closest to the spine is the multifidus. The multifidus is a small muscle and its role is to hold one block of bone to the other. It does not have strength to move the spine. All it has, it is a short muscle and holds one block of bone to the next block of bone. But when that doesn't work and when the other muscles work, there will be abnormal forces through the vertebrae. Unfortunately, after an episode of back pain or a back injury, the small muscles become weak quickly. And because they are small, they do not come back into action or they fail to work, and then the large muscles will compensate. And when the large muscles are compensating, there is no need for the small muscles to come back, and the small muscles become even more weaker. But that is not useful. Unfortunately, that will cause more pain than what we experienced initially. Because unless the blocks of bones are held in place to each other with the help of the small muscles, only if the large muscles are working, the abnormal forces come through. And that is why patients with back pain say, I try to do the exercise and it hurts me even more. They are not lying, it is very true. So coming to the small muscles or the multifidus, that is the innermost muscle. Unfortunately, when they go to sleep, they never wake up. It is very difficult to wake up and the larger muscles have taken over. But this is not helpful. So how then can we get the small muscles to work? So there is, unlike say for instance the biceps, if this is weak, I can take a dumbbell and do exercise and build up this muscle. But that way, it is not easy to build up the multifidus. But what we know from research is that we can do some other action, and when we do some other action, we can stimulate the multifidus and make it work. So the simple measure of pulling the belly button to the spine or the abdominal drawing in maneuver is what is necessary to reactivate the multifidus muscle. When you pull the belly button to the spine, we are not trying to strengthen these muscles, but there is a nervous connection between this muscle and this is the transverse abdominis and the multifidus muscle that the multifidus starts contracting. So we need to get the multifidus to come back into action. And the only way to do that would be to pull the belly button to the spine. When we pull the belly button to the spine, you are contracting the transverse abdominis, but there is a nervous signal that goes to the multifidus and slowly it starts working. Because we need stability in the back. If there is no stability and the larger muscles are working, it, as I said, causes abnormal forces and increased pain. That is why people with back pain say, I do some movement or I do some exercise, it hurts me more. So to help them, they need to do the abdominal drawing in maneuver or pulling the belly button in. So ideally, it is not just pulling the belly button, you also need to pull up the pelvic harness. The pelvic harness is a group of muscle at the very bottom, holds all our pelvic organs in. If by pulling it up, you are like for instance, you are going for a show, you are waiting in a toilet and there is a long queue in front of you, you are desperate to make a V, but you can't V. That is the same muscle that you tighten. So pull the pelvic harness up and pull the belly button in. And this movement is very essential because that is the only way we can kickstart the multifidus. Because the multifidus, once it goes to sleep, doesn't wake up. So we are going to do first 4 exercises. And these exercises are the only things that you need to do if you have severe back pain for a period of 4 to 6 weeks. You don't need to do any other exercise. But this exercise needs to be done 120 times each day. I know it looks a lot, but by just doing that 120 times each day for 6 weeks, you can make severe back pain go away and it will be much more controllable. So, how do you do the 120 times? 30 while you are sitting, 30 while you are standing, 30 while you're lying down, and 30 in the quadruped position. That is, you're on your hands or knees or like an animal. So it is important that you're doing this 120 times each day. It may seem a lot, but that is important, because that is the only way we can wake up the sleeping multifidus. And unless we wake up the sleeping multifidus, the back pain is not going to disappear. Because you must understand, even if I have to lift a bottle from the shelf, as soon as my hand moves away from my body to hold even a small bottle, this is like a crane. The base has to be strong. And for the base, the first action in the base is the multifidus has to lock the individual vertebrae in place, and then this hand can hold it. If it is a big bag, it can lift it up, but the outer muscles will do the lifting, but the stability or holding one block of bone to the other is done by the multifidus. That is the importance of the multifidus. So let's now do the 4 exercises of kick-starting the multifidus. Each of these exercises needs to be done 30 times. So totally 4 into 30 is 120 times. So I'm going to do pulling the belly button in the sitting position. So sit comfortably, facing forward, and as you sit and hands on your thighs, pull your belly button in. I'm pulling my belly button in and also the pelvic harness up. But that doesn't mean I cannot breathe. I am breathing. I am speaking to you, though my belly button is pulled in. And we need to hold it for a count of 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then you can relax. Doing this 10 times is one set. So while sat down, you want to do 3 sets. But that doesn't need to be always in the morning or always in the evening. You can divide it. It could be while you're having breakfast, while you're in the car and waiting for the red light to turn to green, you can do it once. So cumulatively over a day, you have to do it 30 times while you're sat down. Similarly, the same exercise you need to do while standing. And let me explain that. How do we do that? So I'm going to move the chair and show you how we can do that same exercise while standing. So I'm going to show you how you can do the pulling the belly button in or abdominal drawing in maneuver while you're standing. So stand in a normal position with eyes facing forward, and you're pulling your belly button in and your pelvic floor up, and count 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. While you're pulling your belly button in, you can breathe, you can talk. It is just, you're just contracting that muscle. That is all that you're doing. So, the third position is while you're lying down. And I'm going to lie down and show you how I'm going to do the same abdominal drawing in maneuver or pulling the belly button towards the spine maneuver. Though I am lying down on the floor, you don't need to lie down on the floor to do this exercise, because some people find it difficult to lie on the floor. You can lie on your bed and do the same exercise. As long as the bed has a firm mattress, it is fine. If you can lie on the floor, it's good, but it doesn't matter if you can't lie on the floor. You can do it while you're lying down on the mattress. So it may be advantageous to do this exercise early in the morning and late in the evening when you're going to bed or getting up from bed. So if you do 15 times in the morning, or 1.5 sets, 10 being 1 set in the morning, and 1.5 sets in the evening, that is all that is required. So let me show you how to do that while lying down on your bed or on the floor on a yoga mat. Now I'm on the floor and I'm going to demonstrate how to do the same exercise, pulling the belly button to the spine while lying down on the floor. So this is my normal position. You can see my abdomen is out, protuberant slightly, and I'm going to pull it inside and pulling the belly button towards my spine, and the same way pulling my pelvic harness up. And I need to hold that position for a count of 10. So I'm going to start that. You can see I'm pulling the belly button in and the pelvic harness up. And 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. So by doing that, you are contracting the transverse abdominis and also contracting the multifidus muscle. So this is the third position in which you need to do the exercise, and you need to do it in the lying down 30 times. And ideally, if you do it 15 times in the morning when you wake up and 15 times at night when you're going to bed, you would have completed the 30 that you need to do for the lying down position. Then the fourth position is the quadruped position, or where you're in your hands and knees. In this position, you're not moving your hands or knees at all. In this position, you're pulling up your belly button again. I know it is not easy to see through these t-shirt, but I am pulling up my belly button and similarly pulling up my pelvic harness. So as relaxed in this position, I am pulling up my belly button and the pelvic harness and counting for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. And again, this needs to be done 30 times. Now, people underestimate the importance of the abdominal drawing in maneuver. They think it is a simple maneuver, silly maneuver, and it cannot make back pain better. I have had experience with patients with severe back pain who do just this simple exercise. It is important to do it religiously, 120 times every day for 4 to 6 weeks. And then there is a change. Because, as I told you, it is not just the strength of the muscle, it is the synchrony that is important. Just like in a gear, it has to fall the first, the second, the third, and the fourth. And then only the motor works or the car moves. If it slips into 4, it is not going to move. Yes, this simple exercise of pulling the belly button in is going to make that happen. But you need to have patience and you need to have perseverance. Doing this simple exercise 120 times each day for 4 to 6 weeks, then your severe back pain can be converted, because then you're getting your first gear to work. Because as long as the first gear is not working, your back pain will continue. So please give heed to this particular thing that I'm telling you, is the pulling the belly button or the abdominal drawing in maneuver, and doing it religiously 120 times. And I cannot repeat it enough for people to understand. There are patients who think that this is such a simple exercise, this is not going to make the back pain better. But on the other hand, patients who persevere with this simple exercise have converted their back pain into their much copable, just some mild back discomfort. So please, it is important that you are doing these the same pulling the belly button in the 4 positions. There are 3 other exercises I want to show you today, and again they are on the floor or can be done on the bed. Again, during all those 3 exercises, it is important that you are always pulling your belly button in. So 3 are in the quadruped position, and the last one I will show you where I am lying down and doing a plank, not a forward plank, a back plank or a bridge. So let me take you through the other 3 exercises done in the quadruped position. So here, before we start the exercise, again every exercise you need to pull the belly button in. So we are going to stretch the right arm, then the left arm first, and before I do that, I need to pull my belly button in and then stretch my arm out. It is trying to retrain the multifidus, all these exercises, and that is the key to low back pain. So I am in this quadruped position. It can be on the floor, it can be on your bed,
and I'm straightening, pulling my belly button in and my pelvic harness up, and then I'm straightening my right arm forward. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Lower it down. So that was on the right arm. Now we will do it on the left arm, straightening it out and counting again. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Lowering it down. So that was doing with your arms. Next exercise is doing with your legs. So again in the quadruped position, either on the floor or on the mattress, you can straighten out your each leg so that they are parallel with your trunk. So again, before the exercise, try to pull in the belly button and keep the belly button pulled while this exercise is being performed. So starting from this position, pushing your right leg back so that the right leg and the trunk is in a single line. And during that procedure, keep the belly button pulled in. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. And now with the opposite leg, same maneuver, pushing the leg backwards till it is in a straight line, and start off by pulling the belly button in and keep the belly button in while the leg is out for a count of 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax. So that was the second set of exercise. The third one is slightly more complex. We have to put our hand and leg out, but the alternate hand and the opposite. So if the right arm goes forward and the left leg goes backward, and then you have to maintain that position. This is not an easy position to do. Some people may not be able to do it. It doesn't matter. It is the belly button, the first four, that are more important. So how do we do this? Let me show you. So I'm lifting my right arm and my left leg. So my right arm, my trunk, my body, and my left leg are all in a straight line. And I'm doing that. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Slowly relax. And now we can swap the sides. So the left arm and the right leg. So I'm going to do that in this quadruped position. Left arm forward, right leg down, right leg backwards, all in a straight line. The left arm, the trunk, and the right leg in a straight line. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Relax and down. So in all those positions that we were doing, we were pulling the belly button in. People with severe back pain have difficulty lifting their arms. Even they are unable to get their arms above the shoulder level. Because as I told you in the beginning, the arm is like a crane. The crane can put out an arm only if the base is strong. But if the base is not strong, so as soon as I put up my arm, if the first gear doesn't engage and hold the vertebrae together, the other muscles are working and it causes abnormal pain, and that is why they are not able to lift their arm. Whereas, so that is why this, when we saw this exercise being done, I was lifting my arm and lifting my leg, and at the same time pulling the belly button in. If you have back pain, it is important that when you do any activity, you need to pull your belly button in. It may be taking a sheet of paper. A sheet of paper may weigh less than a gram or 2 grams. Even when you lift that from the table, pull your belly button in and then lift the paper. Because this has to become a habit. And when you do that repeatedly,
then the multifidus comes back to action and it becomes synchronous. And your gearbox in your back starts working and the first gear falls and everything comes back to normality. So it is important that we are doing this and retraining the multifidus muscle. The final exercise in the back is called the bridge or the back plank. So I'll show you how the bridge is being done. You lie on your back as comfortable as possible, looking up, keeping your hips and knees bent so that your feet is flat on the floor or on the bed if you're lying on the bed, and your arms by your side. And in this position, you're lifting your hips up and maintaining your thighs and your trunk in a straight line. And for that, the muscles in your lower back has to contract and the gluteal muscles have to contract to maintain that position. So this is what you are doing. So your upper part of your shoulders or the chest is on the floor, your feet are on the floor, but your trunk and your body and your hips and thighs are not touching the floor. So here the gluteus and the lower back muscles are working. This is called the bridge. It is also called the back plank. Ideally, someone needs to be in this position for 180 seconds. But now, as we are doing the exercise, we again need to do it only for a count of 10. So once I'm in this position, I'm pulling the belly button in, my pelvic harness is also up, and I count 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and gently go down. So these three exercises which we showed in the end needs to be repeated 3 times in the morning and 3 times in the evening. But the belly button to the spine is the most important exercise. It may be very simple, but it is going to make the crucial change from severe back pain to a much more tolerable or even only a mild discomfort. I have seen a lot of patients who do this diligently and religiously and have made their backs better. Thank you.